Welcome to the next segment of our microlearning program on healthcare quality improvement basics. This program is based on the model for improvement recommended by the Institute for Healthcare Improvement. This segment will focus on how to determine what changes to test to support your quality improvement efforts. The fundamental questions of the model for improvement can be addressed in any order. You may start with a change you want to test and then determine an aim and evaluation measures. Or you may have an evaluation measure you want to improve and then identify a change to test and an aim. No matter what order you address the fundamental questions, you will at some point determine changes you will want to test. This is the next step in the quality improvement process. When working on quality improvement efforts, often many small changes are required to improve performance. Testing one small change at a time, often on a limited scale, is an expected approach and is part of the IHI model for improvement. There are many quality improvement tools you can use to help your team develop a list of changes to test. For example, the 5 Whys is a simple approach to help a team identify underlying reasons for a problem or why outcomes are not as good as you would like. Creating a driver diagram helps your team identify what drives or contributes to the outcomes you are hoping to achieve. Simply brainstorming ideas with your team is often the first and easiest way to begin to generate your list of change ideas. You can review data to help generate ideas or identify areas of concern. When performing the brainstorming activities, make sure to include staff members who are closest to the work. Use them to help generate suggestions or changes to test to help reach your aim. Here are just some questions to consider when brainstorming. Sometimes these questions can spark a discussion among your team that can lead you to ideas or changes to test. You also might want to consider how technology can help support your quality improvement aim. Looking into the available functionality of your EHR may help identify additional changes to test or ways you can leverage technology to support your workflows or data reporting. Quality improvement efforts can unknowingly improve care for one group of patients while worsening it for another. It is important that you keep health equity considerations in mind when brainstorming and researching changes to test. Once you have used the tools needed to answer the question, what changes can we make that will result in improvement, review the list with your team and choose one change to test. The next segment covers how to use the PDSA cycle to support your quality improvement efforts.